sitting just off camera with one foot up and looking very adorable, but you don't get to see it. Today we're going to talk about written exposure therapy, or WET for PTSD. We are going to talk about what it is, so you can see if you want to ask your therapist about it. And there's pistachio. And we're going to talk about evidence for it, which is very exciting. So I found out about written exposure therapy because I was recently diagnosed with PTSD. I am a physician who has seen a lot of nonsense, bad things, and I realized recently when someone came to visit my husband what a wreck I am. I had thought I had made a lot of progress with a lot of this emotional trauma, but it was kind of stunning to see how difficult it is for me to interact with people, which didn't used to be the case. I was always a social butterfly. So, not being able to interact with people does not mean you have PTSD. You need to see my video on the PTSD criteria from the DSM-5 if you are curious as to what qualifies. Baby girl, why don't you sit on this thing over here? You like that thing, so stay there. Stay on that. I gotta do squishy sounds for the people. So, does my hair look ridiculous? I have no idea because the camera is now reversed. I hope it does not. So what is written exposure therapy? It is something that my therapist wants to try with me. I hadn't actually heard of it before. I had heard of exposure therapy. It's a pretty common, like the evidence right now for PTSD is all related to, exposure therapy. This is a particular kind of protocol, which is 30 minutes of writing per session, which was found to be as efficacious as 12 full sessions of cognitive processing therapy in veteran and non-veteran adults treated for post-traumatic stress disorder. That's according to Sloan, DM, Marks, BP, Lee, DJ, Jessica, BA, in JAMA Psychiatry 2018. So you can look that study up. WET also had significantly lower dropout rates than other trauma-focused techniques, in the range of 5 to 10%. This is literally what she said, because she knows that since I'm a doctor, evidence matters.
I love you so much. But you can't have my microphone.
No. She wants kisses and stuff. My lips are dangerous. I know that this stuff has not been tested on animals on my mouth, but that doesn't make me feel certain that animals need to have it on their mouths. So what is it? Basically, it's 5 sessions of 30 minutes of writing, where you reprocess and go back through the trauma. It is a baby girl step. Here, hold on to this finger. It is for practice by licensed psychologists. But you can certainly take some of the principles for self-care. I will be doing my first session this week. Maybe today or tomorrow, depending like these sounds. She's gonna crinkle some paper for you. So, let's look at the studies. Do you like that sound even though you can't see it? It's a good sound. So let's start with the specific instructions, just so you understand before we go into some of the studies that I found, so that you understand what a session would look like. So, for example, the first one that she sent me gives first psychoeducation on what is PTSD. What does it mean? And of course, if you would like psychoeducation on PTSD, the other PTSD video is a good place to start. That said, it's good to understand that you may have changes in physical reactions due to trauma. And they may be changes such as fatigue, nausea, sweating or chills, muscle tension, your heart racing, problems with sleep, changes in appetite, or you may have emotional changes like anxiety attacks, feeling nervous, on edge, hypervigilant, or startling easily, anger, irritability, difficulty trusting or having loving feelings, guilt or self-blame.
No, you may not have my computer.
Or shame, grief, or depression. So changes in your thinking may include flashbacks, nightmares, difficulty remembering things, difficulty concentrating. You may be overwhelmed or have too many thoughts at once, or have memory gaps. Definitely visit the other video if this is something that interests you, or if you're curious, if maybe you should ask your physician if you have PTSD. Now, so after giving the psychoeducation, right, so that people understand what is PTSD. Get off my hand, thank you. You have the writing instructions, so you don't worry about spelling or grammar, and you write the details of the trauma as you remember it at the moment. How it happened, who was involved. Okay. When you are writing about this trauma, they say start at the beginning for the first session. For instance, start at the moment you realize the trauma was about to happen. And try to remember as many specific details as you can. In addition to writing the details of the trauma, you should also be writing the thoughts and emotions that you experienced at different parts of it. For example, you might have had the thought, I'm going to die, or this can't be happening. Remember, you don't need to finish writing about the entire trauma in this session. Just focus on writing about it in as much detail as possible, and include the thoughts and feelings you experienced during and immediately after. Remember, the trauma is not actually happening again. You're simply recounting it as you look back upon it now. Now, those of us who have intrusive thoughts, this can be scary. So if your physician or your psychologist is having you undergo a therapy like this, I just want to encourage you and say you're not the only one who's scared, okay? I totally get it. I am pretty freaked out. I guess I'll do this tomorrow. tomorrow, but I have to do it before I actually meet with my psychologist again, and it's scary. But you know what? It's evidence-based. So, of the studies that I pulled up for you, and it took me just a couple minutes on PubMed to find these studies, okay? Just a couple minutes, so easy. Okay. So, PubMed.gov, that's where you go to fact check me. It's a good starting point. Science Direct in Cambridge and Oxford all have their own databases, and some of them are quite good. So, you might start with a review article. You can probably get the free full text in Current Treatment Options of Psychiatry 2019 by Joanna Thompson Hollins, titled Brief Novel Therapies for PTSD Written Exposure Therapy. Okay. And they analyzed a number of different treatments and talked about WEP, so it's a kind of good introduction. But you've already had an introduction because we read through the first page of the actual protocol together. Eventually I'll have the whole protocol because she's going to send it to me as she does it to me. So that's kind of cool. So I'll let you know how that goes. I'm not advocating that you do it with me, although you certainly could. You could do day one, and then the next week, along with me. That's certainly welcome. But make sure that, you have somebody safe to do with, someone to talk with you over your work, check you, a good psychologist or psychotherapist. I always tell you guys this, but if you qualify for free care through your local government, go for it. And your local health department, even if you're in a place with privatized medicine like the US, your local health department may be able to hook you up with some free resources. You're writing this down. Plus, I have the number to the crisis text line below in the description. And you can use that. Yeah. You can use that to get plugged into free resources. You like paper sounds? So, what if you don't qualify for free resources? I can still get you 15% off therapy. You should know by now, betterhelp.com/drjen. That is my affiliate link. It does support the channel. But bottom line is you gotta find something that works for you. So what if you can't go to a therapist at all, like you're afraid to do so? Text the crisis text line, or hook up with somebody in your area that you kind of trust. Sometimes, so my reverend, she has a counseling degree. She's the wife of the pastor at the AME church I currently attend. Those of you who know me know I care a lot about Judaism and the Torah, but I currently go to an African Methodist Episcopalian church because I was really impressed with how they are helping the poor in the area. That's really important to me. So anyway, she is a trained counselor. I believe she's an LCSW. And sometimes you'll find those resources in schools. Don't bite my fingers, you bud. And sometimes you'll find them in parishes, churches, maybe in your synagogue. Look around. Or ask a friend. This particular therapy is one to ask a therapist about. But even if you can't do this particular therapy, right, I kind of wanted to introduce you to it as I go through it so you understand what the experience is of a patient going through it. And the value of not running away from the stuff that terrifies us the most. The stuff that keeps us up at night, and the stuff that makes it so hard to talk to people for fear of what they could do at any time. CBT protocol also that includes writing it down, just so you know. What are you doing? Look at this bird. Look how silly she is being. Look how strong she is. So, you could start with a review article, but we have already covered some of that. There is in the Contemporary of Clinical Trial, excuse me, the Journal of Contemporary Clinical Trials Communications in 2019 December, they did a study titled Study Design Comparing Written Exposure Therapy to Cognitive Processing Therapy for PTSD Among Military Service Members, a Non-Inferiority Trial. And the authors on that are Denise P. Sloan, Brian P. Marks, Patricia A. Resick, Stacy Young McCaughan, Catherine A. Dondenville, Jim Mintz, and Brett T. Litz, and Alan L. Peterson. There's a lot of people on there. Through the Strong Star Consortium. So, what they did is they started a randomized controlled trial. A non-inferiority trial is a trial in which you compare the current standard of care, which is cognitive processing therapy, and use it as the placebo, basically, as the control group, not the placebo technically, but as the control group for the new therapy you're trying to study. So that's an interesting protocol to read. However, their N is only 75 each. So, let's find. So we're going up in evidence each time, right? A review article, okay, that's kind of neat. Gives us a general overview, doesn't prove anything. An ongoing trial, alright, that's neat. The N number isn't that big, but at least we're getting somewhere, right? At least we're getting somewhere. But now we're actually getting somewhere. This is in the Journal of Depression and Anxiety. It is a randomized controlled trial from 2018 October. This one is called Long-Term Treatment Gains of a Brief Exposure-Based Treatment for PTSD. Some of the authors in the other thing are here. Joanna Thompson Hollins, Brian B. Marcus, Daniel J. Lee, Patricia A. Resick, and Denise M. Sloan. And they talk about written exposure therapy. And they compared gains after 60 weeks from the first session, and also evaluated the effect on depressive symptoms, which is really interesting because that's something I have. I have both major depressive disorder and PTSD. The study enrolled 126 individuals with PTSD, randomized to WET or CPT. Assessments were conducted at baseline and at 6, 12, 24, 36, and 60 weeks following the first treatment session. PTSD diagnosis and symptom severity were determined via the clinician-administered PTSD scale for DSM-5, the CAPS-5, right? Which is similar to the questionnaire that I go through with you guys in the PTSD video. And here's what they found. WET remained non-inferior to CPT through the 60-week assessment. The groups had a difference of less than 3 points in their total CAPS-5 scores, and within condition effects on PTSD were large. What does that mean? That means effects as the condition itself improved. They do scales. Both treatments significantly reduced depressive symptoms over the 60-week study, with the CPT group experiencing a more rapid decrease. So CPT, not CBD. So CBT, cognitive behavioral therapy, is the one I talk about a lot. Cognitive processing therapy is one I don't have a lot of experience with, but has been used as a standard for PTSD. They had a more rapid decrease in depressive symptoms. But as far as PTSD symptoms, WET was non-inferior. So that's pretty cool. It was non-inferior to the standard. Oh, I closed the tab that I didn't mean to close. Oh, that's fine. I'll close that tab. It's only a study design. I think we already looked at this.
Yep, this is non-randomized control trial. Why are there so many? Here we go. Here's a finished one. So this was a study from the Journal of Behavior Research and Therapy in 2012. The authors are Denise Sloan again, Brian Marks, Michelle Bovin, Brian A. Feinstein, and Matthew Gallagher. And they talk about written exposure. I think this is 2 Lab Baby Girl. As an intervention for PTSD, a randomized clinical trial with motor vehicle accident survivors, which is interesting because a lot of the studies have been done on combat veterans. So this is maybe more relevant to some of you. This had a small N value, 46, but they did finish their data, and we do have the data available. This just came out in 2021. Significantly, what's interesting is instead of comparing in-condition with in-condition scales, they compared the diagnostic scale. And they found that participants assigned to WET showed significant reduction in PTSD symptom severity at 6 and 18 post-baseline relative to waitlist patients with large between-group effect sizes. So this time they had the group randomized. This wasn't a non-inferiority trial. This was like a true case-controlled trial. Well, not case control because that implies something else. This was a true controlled trial where one group, instead of giving them nothing or placebo, they put them on the wait list. Which isn't a perfect match, right? Because you can't really control for the placebo effect that way. It's harder to control when you're studying. Don't yell in my ear. Let go of my finger. It's harder to control studying therapy techniques than it is a pill where you can give someone a sugar pill, right? But this is the interesting part. Significantly fewer WET participants met diagnostic criteria for PTSD at both the 6 and 8 week post-baseline assessments relative to waitlist participants. And they were maintained, those treatment gains, at 30 weeks. I think that's awesome. WET participants reported a high degree of satisfaction with the treatment as well. So, that's a good one. That's a good study. So, I'll go over one more. I think that we already did this one. Some of these are like repeated a bit. This is a randomized control trial. Yep, we're going to go through one more. So, oh no, this is another study design. This isn't the actual. Yeah, there's this big study going on with WET and mindful-based mobile app stuff in China right now. And you can register for the trial if you like. It's a little too late. I think you have to register before. Well, no, you may still be able to get in. If you would like to donate your, well, you're not in China, so, well, you might be in China. Here you go. So the trial registration is going to be linked below. Let me check it right now. Let's see. You might be able to get the free therapy if you're in China. Oh no, I can't read this page because I can't read Chinese. Oh no, it's gone. It's gone. People are already done with it. So sorry, you can't. But you can see it's a big hot topic in psychology right now. It's something people are interested in. And it's something to ask your psychologist about if you have PTSD. I hope this has been informative and relaxing. I know with behavioral health we kind of go down the rabbit hole and really dig into like kind of highly scientific stuff. But that's because this is the stuff that you're most likely to be able to benefit from, right? I can't like perform a procedure on you over the video. I am hesitant to do that unless it's totally fictional, just because I don't want to establish bad precedents or assumptions about certain kinds of treatments, right? But this is something where like you can learn information that you can actually use. And 30 minutes a week. Try writing your stuff out. That, like, there is a lot of evidence for just journaling and just writing, even if you don't have access to this kind of protocol. This kind of protocol is meant to be done with a therapist, but, and that's what, I'm going to recommend that you do. Because if you do have a severe stressor event, that's important. Important to have someone there to catch you, basically. But at the same time, there's a lot of evidence for just writing out your stuff on your own, like journaling. Nightmare rehearsal therapy you can do on your own, and again, the writing is a big part of it. So write out what happened, Do it kind of like with nightmare rehearsal therapy, how we have you write out the nightmare. This time, write out the thing. Write out the thing, and then write at the end what you're gonna do from now and how you're gonna be stronger. Use the principles that we learned in nightmare rehearsal therapy, and use some of the principles from written exposure therapy, and help yourself. And don't be afraid to ask for help. Right? The crisis text line is always in the description, my people. Always. Along with the link to the relaxation club, which does not cost anything. It is me emailing you cool evidence-based things that are not in these videos. And it's an easier way to stay in touch with me. I check you